Hello, today we have Louie. He's currently sedated. The reason he came in today is because the owner noted that he had a very smelly mouth, and he's only a 10-month-old puppy, so that's quite uncommon for a dog to have such a smelly mouth at this age. When I looked in the mouth, there was a twig stuck on the soft palate between his molar teeth. So he must have chewed it in the garden and somehow it got stuck. It must have happened somewhere in the last week, and the owners only noticed that he was having this smelly breath and seemed to be off his food for the last 2 days. So yes, he's asleep now. The reason we don't usually sedate them for this procedure, but because he was a bit boisterous with us and didn't allow us to hold him quiet and without movement, we did a light sedation just for safety for him, just so we can get to the twig and pull it out without harming the rest of his mouth. And yeah, we'll show you inside the mouth shortly how it looks now, before and after, and then we'll reverse the sedation. And depending on how it looks after we remove the twig, we might need to give some painkillers or antibiotics, depending on what's needed. So as you can see there's the twig that's stuck there. There's also a thorn there that seems to have cut a little bit of the palate here. So we'll now just use the pliers to pull it out. There we go. You can see here there's quite a bit of a thorn on this twig. Alright, there you go. And now we'll just assess the mouth. So there's quite a bit of infection and some damage here to the palate. And we'll just clean up there a bit and show you again some more. Remove the twig now, and there's a bit of damage to the gums around there. The foaminess here is just from us cleaning. I'm going to do a final rinse now. There's some gum damage along the tooth there and along the other one here at the bottom. But there's no bone exposed, so we're going to leave it as is now, like that, without stitches. And this should heal by itself within the next few days. We'll get him back for a follow-up check just to make sure the mouth is healing nicely. He'll go home with some antibiotics and painkillers, and everything should be fine. Alright, so Louie is awake, although still a bit sleepy from his sedation. And he'll go home with some oral antibiotics and painkillers, and he'll come back for a checkup in a few days just to make sure the mouth is healing well. And hopefully everything will be fine.